to the right side when you're laying down.
Yeah.
You notice that?
I've never seen it, but I can feel it.
Okay, can you point exactly to where it hurts?
There's no pain right now, but usually when it buckles up, it's like in this area.
So it usually gets pissed off right here in the low part.
Yes.
That's a little bit tender. Painful here?
Oh, yes,
Jeez,
super
okay.
painful.
I'm gonna compare, okay?
Okay.
This one is probably tender too, but not as bad,
Yeah,
right?
not as bad.
Okay. And you said that you have that low back pain when you do stooping movements. For example, deadlifts, right? You said?
Yes.
What else?
I felt it during squats too.
When you go through a very heavy leg day, that bothers you too, right?
Yes.
Okay. Do you feel like it's localized or does it shoot down the glute sometimes?
I don't notice that it shoots down the glute.
Okay, good, good. And you said you have a pre-existing bulging disc in the low
Yes.
back.
Mhm.
One up again. Up. Good. And this one? Up. Good. Okay. Slight weakness of the glute of the left side. That causes you to have a pelvic imbalance. So because that glute on that left side is not activating as much, then what happens is that pelvis starts to shift down on that left side, which means that you're not evenly distributing weight on both sides. So when you put that squat bar on your back or you start deadlifting, then you're asymmetrically coming up. Does that make sense?
Yeah.
You have a lot of compensation along the low back, the outside, which is the QL, and as well as the glute in the outer hip region. This will typically cause your hip flexor to also be tight. And we talked about this, you don't stretch much.
I know, I stretch a lot. I do a lot of dynamic stretching before, but I don't do stretching after, which
Yeah.
is more important than
So we're gonna be loosening up your low back, the outside of the glute as well. As you can tell, it's probably tender. We're gonna be stretching out your hip flexor and getting you adjusted. And also we're gonna start talking about rehabilitative exercises for that pelvis so that this doesn't get upset. You know what I mean? I just have to loosen up certain areas in the low back. I just want you to bear with me. I'm gonna do some trigger point therapy. That means that I'm going to dig into your low back. It's not meant to be pleasant. And we talked about the pain tolerance. I don't want you to worry about it, but let me know if it's too much, okay? This is that paraspinal muscle that tends to tighten up on you.
Yep, that's like exactly how it feels when it tenses up.
Yeah. You'll notice that the outside muscle, the QL, for you, it's so compensated, man. That thing is pulling you and tightening up so much where it's aiding that pelvic imbalance. And just bear with me, I'm sorry. Good job. So we got two structures. Paraspinal, which is closest to the spine. The outside area, which is the QL. And they all synergistically get tightened up and you start pulling on everything, right? That's part of the reason why you feel pain. We have the PSIS here. Glute medius, bear with me, I just have to loosen it up. You're gonna stretch out your hip flexors. The front of the hip on the right side, push it down. There you go, just the hip, not the knee, just the hip. 5, 4, 3, 2, 1, relax it. Good job. You see how much your hip comes up? Okay, we don't want that. We want to loosen that up a little bit more. So rotate right and drive that hip down in the front part for 5, 4, 3, left, and drive that hip straight down for 5, 4, 3, 2, 1, and relax. And these are really good stretches for the back of the hip and the glute. And they'll give you good mobility. You just have to bring the knee to the front of the shoulder on that same side. And then you cross it. So the opposite. Let's rotate this right here. Okay, let's bring this up. Good. Relax that low back for me. Good. And relax. So as you continue to work out, how often do you work out?
5 to 6 days.
5 to 6 days. Jeez, that's a lot. So you'll typically get compensations along the way that'll start giving you an imbalance. Give me a deep breath in and out. Good Good job. Jeez, you stepped all the way up. Good. Wow. That was good. Okay, cool. Let's have you on your side. Face me this way to your left and hold that right there. This is just gonna help with your alignment of the low back and the pelvis. Bear with me.
Oh, shit.
Ah, dude, that was great. Let's get the other side. How'd that feel?
That was nice. I've been trying to do that for a while. But like, that's another thing. Whenever I try and do like this stretch, sometimes I get stuck.
Yeah, no, yeah, you don't want that. Okay, just bear with me on this one. Good job. How's that?
Yeah, that was nice.
This is good for headaches, posture. You've been looking down into the computer all day. You work from your phone sometimes.
Oh my gosh.
Goodness, you see that? I like that, man. Good.
Oh my gosh.
Jeez.
Wow.
How do you feel?
That was nice.
Let's rotate your head left and right. How do you feel?
Good.
How's your
It's
back?
crazy. My back feels good right now. That was great.
Huge take-home points. You have a pelvic imbalance because your glute on that left side is weaker.
Okay.
When that gets weaker, your pelvis shifts,
Right.
which means that that existing disc protrusion that you have, it causes you to pinch the nerve even more. It occasionally causes you to have the sharp shooting pain, numbness, and tingling down the leg. Stretch out your hip flexors, and then you want to rehab the butt area, the posterior hip muscles. All you have to do is put the band, and I like to do it in 3 angles. You go backwards, and then you go at an angle, at a 45-degree angle that way,
Okay.
and then you go outward.
Okay.
So I'll do like 7, 7, 7, or 10, 10, 10. But you do it both sides, and that's going to help that stability in the butt area and the back of the hip to be able to sustain all the weight that you do with all these deadlifts.
Right.
Does that make sense?
Totally. And so should I do that before my lifts?
I think so.
Okay.
Yeah.
And then
You should be doing them at least 3 times a week.
Okay, 3 times a week before my lifts. And how many sets of that should I do?
I would recommend at least 4 sets.
Okay.
Because it's a little circuit,
Yeah.
but that's going to pump the back of the butt.
Yeah.
Foam roll that TFL. You gotta foam roll the butt
Yeah.
and the back.
And then how do you get into this? You just put it like right here and then you just lay on it?
Yeah, legit. All you have to do, like, let's just say I'm laying down on the ground right now. I have a foam roller here, and I just lay on it.
On the side. Oh,
Yeah,
I've
it's on
done
the
that
side.
before. Okay.
It sucks,
Yeah.
right?
But it's okay. I
Yeah.
need to do it. Okay.
But that mobility is going to help you so much. It's going to open up your hips more. You need to start doing these hip flexors because when you're coming up and in, it's starting to hurt the groin area.
Yeah.
And that tells me that that's beginning symptoms of impingement of the
Yeah,
hip.
we don't need that.
That's not good either, right? We already have this back thing going on.